Good evening. The time is now 5 o'clock and welcome to our webinar on childhood illness, helping you look after your child. My name is Dr. Tariq Kapasi. I am a local general practitioner based in Leicester City. I'm the medical director of Willows Health and honorary associate professor at the Centre of Primary Care Research. Real privilege to have our audience join us tonight. And I suspect through the course of the next half an hour, we're going to have plenty of people join our webinar. This webinar is being recorded, and the idea is for this to be posted onto our YouTube channel so it can be accessed by lots and lots of people locally. So just by way of introduction, Willows Health is an organisation in Leicester City. We're the biggest general practice organisation in LLR. And during coronavirus, we produced a series of webinars educating the people of Leicester on COVID and the precautions they need to be taking. Now, from feedback we've had from the thousands of people who had joined our webinars, many had felt that this was the most useful snippet of information that they received on COVID at the peak when people were really keen on information. And off the back of that, we are planning on delivering a series of webinars on child health. And this very much is a LLR CCG collaborative using the Willows Health platform. So this is the first of many webinars we plan on delivering to the patients and people of Leicester City. This is your opportunity to really ask the questions that matter to the specialists who are going to be on this call. And what we've really found is that that interactive feature of being able to post a chat to a clinician so that we can answer it is really, really useful for you. So please do put your questions on the topic that we're presenting today on the chat. Just a couple of housekeeping rules. So your cameras and your mics have been turned off for today's webinar. If you do have questions, you can place them on the chat. Just be mindful that the people who are attending this webinar, if you place a question into the chat, your names will be visible. So if you would rather remain anonymous, then now is the time to change your name to something anonymous. Let's crack on with the rest of the webinar. So this webinar is really intending to give people a understanding of how to self-care and a better understanding of what's normal and how illness can be a normal part of a child's life. And it's really important that those kids who eventually do need to be seen are seen by the right service at the right time at the right place. The purpose really is for parents and guardians to help improve the understanding of when and how children can become unwell. And in this webinar, we're going to be talking more specifically about one of the most common manifestations of childhood illness, and that is a fever. So we're going to talk about the common questions that relate to childhood fever and how we treat it. We'll also think about what should precipitate you to go and seek medical advice if that's required. But you'll see through the course of this webinar that most cases of fever can be safely dealt with at home. It's really important for you as a parent to obtain the right medical advice at the right time in the right place, and I'm hoping that we can do this through the course of the next 20 or 30 minutes. So on a final note, just important to remember that the webinar and the medical information given here doesn't replace individual medical advice, and if it is individual medical advice pertaining to something you need to seek advice for, then you can do that by going to the correct channels. We're going to be talking about what that actually means and how you can obtain advice for your children from the correct channels later on during this webinar. So without further ado, I'm going to introduce the panel for today's short webinar. So we've got Dr. Damien Rowland, who is consultant in paediatric emergency medicine, is the head of service at University Hospitals of Leicester for the paediatric ED, and is also honorary associate professor. And Dr. Rowland has done plenty of work nationally and is really sort of innovating when it comes to paediatric emergency care. So welcome, Dr. Rowland. Our next panelist is Professor Rizvi. So Professor Rizvi is a general practitioner. He's also a professor of general practice in primary care. He leads the LLR's commissioning group when it comes to the delivery of urgent care in the city. So Professor Rizvi is very much the man to be asking the questions in terms of where you go to for your child's treatment. Without further ado, we're going to go to Dr. Rowland. So welcome, Dr. Rowland. Thank you very much for joining us on this webinar. I'm pretty sure there's going to be lots of parents on the call, including myself, who are really keen on understanding what your perspectives of childhood illness are. Just by way of introduction, Dr. Rowland, just over to you and just a few perspectives on childhood illness before we get to the nitty-gritty questions.
Yeah, thank you very much, and I'm really pleased to be here. What credibility and qualifications do I have? Well, I am a paediatrician who specialises in emergency care, but probably more importantly, I'm a dad. I have two daughters, I have Isla and Bella, 12 and 9, and I have seen them growing up have a wide range of illnesses. And both my children have been admitted to hospital at some stage with something, and they've had plentiful numbers of coughs, colds, fever, diarrhea, vomiting, and what have you. And I can tell you, it is much more difficult to be a dad than it is being a doctor. I think I sympathise a lot with parents and carers at the moment, because it's been an extremely challenging 18 months. There's this kind of level of anxiety about everything at the moment, but especially parents who are on this call who perhaps have only had children in the last 18 months. And in 2020, there weren't the circulating viruses and bugs that children were exposed to. So lots of people are seeing their child unwell for the first time. And it can be scary and it can be quite frightening. But as I think you really rightly pointed out, illnesses is actually normal, and in fact it would be abnormal for a child to go through the first 5 years of their life without a fever or a head injury or tummy pain or diarrhea and vomiting. All of these things are a normal part of the growing up process, and they're important for our immunological development. And so I hope we can use this webinar to debug a few myths about illness, basically.
Thanks, Dr. Rowland. And we can come to some of those myths a little bit later. I'd be really interested to hear what the common myths that present to you in the emergency department actually are. And I suspect you're quite right, actually. There is tremendous anxiety about illness in this COVID era. And that heightened anxiety we can see in all sort of medical corridors, including general practice. Now, one of the manifestations, one of the ways children present to their parents or guardians as being unwell is by showing a fever. Now, is a fever anything to be concerned about? In fact, let's just break it down even further. What is a fever, Dr. Rowland?
Okay, so that's a great start. So the important thing is one, let's debug a myth to begin with. The fever is the body's response to fight infection. The fever is not the bug or virus doing its thing, and that does confuse people, but you'll often hear healthcare professionals talk just about letting the fever play its course, and certainly myself, if your child isn't distressed in any way, shape or form, so they're happy and they're running around and they have a fever, you do not need to treat that. And some people feel uncomfortable. What we're doing when we treat fever is we're not treating fever, we're treating the distress that fever causes. And everyone on this call will have known what it's like to be a bit fluey, you feel cold, you feel shivery, you feel achy, and that's what we're treating. The fever itself is what the body does to get rid of whatever virus or bacteria you have. And what happens is that the body produces an immune response, and that immune response tells a part of your brain to adjust its thermostat. And that adjustment of the thermostat makes viruses especially not like it. They don't like having a high fever, and so that helps get rid of the bug. And there's a small amount of evidence, but it's definitely there, that actually the longer you treat a fever for, the longer the disease process lasts for. If we didn't treat fever at all, it's likely we'd shorten the duration of illness. Now, we don't do that as paediatricians because it's really miserable having a fever. So we're treating the distress, but the fever itself is actually a good thing. And I will repeat that. Fever itself is a good thing.
And that's a really, really important message, actually, Dr. Rowland, that fever is a good thing. And the medical evidence tells us, doesn't it, that actually a fever helps us to fight disease and fight the viruses or germs which are invading our bodies. And it's through years of evolution that we've actually developed a ability to have a fever to allow our bodies to fight off whatever infections are in ourselves. So really important point that fever is not a disease either, and it's a symptom of the body trying to fight something naturally. So often I also feel we live in an age whereby we feel obliged to do something. You know, you feel like your child isn't well, they have a fever, they're a little bit irritable, and often we are just trained automatically to reach for the Calpol or paracetamol or ibuprofen on the shelves, you know. And that's perhaps a cultural change that we all need to make as parents, perhaps. So yes, granted, Dr. Rowland, that a fever is part of the process in fighting the disease, but is a fever ever dangerous?
So actually, a fever on its own is never dangerous. But there are a couple of things that I think parents need to be aware of. So the first thing to say is that actually parents and carers are experts in their children. And while I say, actually, if your child's completely well, you don't need to treat the fever, that rarely happens. And as a parent or carer, you get this sense that your child's not right. You might notice you're getting warm. And actually, at that stage, it's not unreasonable to give them something because you know if you don't, they will get increasingly become unwell. And I think parents and carers are really good at recognizing that trend. But they often give paracetamol or ibuprofen early because they're worried if the fever gets really high, it might cause a fit or it might cause brain damage. And neither of those things are directly true. Now, we know that there are a group of children, it's a relatively small group, who, when their temperature changes, and this is what we think, it's not about how high their fever goes, it's how quickly their fever changes, does make them susceptible to have a seizure. And I get that that causes huge amounts of anxiety. And if you're a parent and carer who's seen your child have a seizure or a fit or a convulsion, that those words all really mean the same thing, it's a very scary thing. But the fever itself, whether it's 38 or 39 or 40, doesn't make a difference. And actually, loads of studies have shown that you can't stop these things happening. You could give a child paracetamol every 6 hours for the rest of their life, and if they're going to have a convulsion with a fever, they will have one. So again, so it's the fever, height of the fever isn't related to convulsion, neither is it related to brain damage. So lots of parents get worried. My child had a fever of 40.5. Isn't that really bad, doctor? No, it's a temperature and it's high. But the temperature itself of 40.5 is no different than 39.5 and no different from 38.5. And yes, some children look more unwell as the temperature goes up, but that's probably because they've had that temperature for a bit longer. So the key message really is that fever itself doesn't do harm.
That's a really, really important message, and one I think parents on this forum will do well to appreciate, that a fever itself does not do any harm, that a fever itself is not necessarily the driver, or rather how high that fever is, it's not a driver of causing a febrile convulsion, or in common sort of terms, a fit. And really importantly, the severity of fever does not correspond with the severity of illness. And that is right, Dr. Rowland, that the severity of fever does not correspond with how madly unwell a child is.
Yeah, I mean, if you want to really play numbers, if you take 1,000 children with a temperature of 38.5 and you take another 1,000 children with a temperature of 39.5, In those two groups of children, you will find potentially one or two more children in the 39.5 group who may have a chest infection or something that needs treating. But these numbers are so small, in 1,000 children, just one more child, it doesn't make any difference. The key learning point now, I think it is important to emphasize, is although the fever itself doesn't do any harm, if your child is 3 months or under with a fever, that does represent a different risk. And that the advice is always that if you are 3 months old with a fever, that is important to seek medical advice. And this is a really good opportunity to talk about how we should measure fever. If I was Prime Minister, the one thing I would do instantly is ban the sale of forehead thermometers. If you have a forehead thermometer in your home, especially one of those strips or maybe some gizmo that you've brought that you kind of fire a light at someone's forehead and isn't medical quality, please get rid of it because they are not accurate. They will tell your child's got a fever when they don't, and vice versa. Your child may have a fever and it will tell you that they haven't. And in children under 3 months, you should be using a digital underarm thermometer. That's kind of a method of the arm. Or if they're over 6 weeks, you can buy a tympanic membrane thermometer. So these are the things that you'll see us use in hospital that go into the ear. Now, I appreciate that they are expensive, the tympanic ones, but digital underarms are relatively cheap. And that is important because we see a large amount of children presenting to our emergency department where parents have come solely on the basis of a forehead thermometer, and by the time their child has arrived, there is no temperature and their child is completely well. And actually, there's some really good studies that parents are actually very good at measuring temperature themselves. Especially mothers. Mothers are amazing because they've spent their lives, or the first of life, holding their child. And so your ability to be able to just touch your child and know they've got a temperature, it's in a way some way better than a thermometer.
There's a few things I'd just like to pick up there, Dr. Rowland. I'm surprised that you're seeing parents pitch up to the emergency department with an isolated or one-off fever using a forehead thermometer. Does that actually happen?
Yes. So that I'm not saying it's massive numbers, but we will have 1 or 2 patients a shift, definitely.
Okay, I mean, 1 or 2 patients a shift over the course of a year is quite a lot. And I think, the other message that we really want to give out in this webinar is to make sure if we do need to seek advice, we're seeking treatment or advice from the right place, right time, right service. So more on that later. One of the other reasons that as a GP, people often come to see us or they want to seek advice is because if children have a persistent fever, or that fever stays on for a few days. Now, we know as doctors that fever often stays for a few days when a child has viral or bacterial infection. So, Dr. Rowland, how long can the parent expect a fever to last for in a typical childhood illness?
So the typical duration is somewhere between 48 hours and 3 to 4 days. And if you draw a big graph, it's this curve basically that goes like this, so that and it peaks at around 2 to 3 days. Most children have a temperature for 2 to 3 days. If your child has a temperature, and this needs to be a temperature every day, not a gap, but if your child has a temperature every day and it's waxing and waning every day, and you get to your 5th day and they're still having this swinging temperature, that is unusual. And again, a bit like the 3-month-old with if you're less than 3 months old with a fever, also if you have a temperature persistently for 5 days, then you should seek medical advice. Now, we get lots of parents coming worried, my child's had a temperature for weeks, doctor. And while I have some sympathy with the fact that it's really difficult, especially now with being off school and having to do tests and isolating, it is very possible for a child to get 3 or 4 different viruses over a couple of months period. And that will present as a couple of days of fever, then maybe 4 to 5 days off, and then maybe another fever again. And I appreciate it's frustrating, but that's very different from having 5 continuous days of fever.
Thanks, Dr. Rowland. So persistent fever for more than 5 days, seek medical advice. And often you will see children who have a fever and parents will be obligated, or they feel as if they need to keep checking their temperature. So this idea of buying a tympanic thermometer, granted more expensive, but what we're saying is that parents don't need to keep checking their temperature. And in fact, I've seen parents wake their children up from sleep because they wanted to check their temperature, let alone give them Calpol when they're resting. Any thoughts on that, Dr. Rowland?
Yeah, so please don't do that. If your child is developing symptoms from having a fever, they will wake themselves up and let you know about it. That will happen. But once you know your child has a fever and have confirmed it, you can start treating, and you don't need to regularly test it, because the best measure of your child's response to treatment is their behavior. And I talk a lot to my staff, as well as patients in the emergency department, about the importance of the difference between the child's behavior and their symptoms. And people get focused on fever, but rather than the behavior of your child. And if your child is running around the room and happy again, then actually that's a good sign. You don't need to keep measuring their temperature, because you know that they're well. And in fact, a brand, a very famous brand of paracetamol, use that in fact in their selling. They say, oh, sorry, if you use our medication, you'll get your normal child back. Isn't that a bad thing? As in terms, because they start climbing the walls and running around like maniacs again. But that's a good sign. So you don't need to keep taking the temperature in that respect. And just as a question about using oral thermometers, there was a big thing about using mercury thermometers in children's mouths. And that's gone out of fashion, because there have been unfortunate incidences where the child has bitten down on the thermometer and broken it, so that we don't use oral thermometers as much now. And in fact, you can for some of the newer digital thermometers, some are designed to be used in the mouth, but it probably is better to use the underarm approach.
Thanks, Dr. Rowland. So just to zoom out just a little bit, clearly we're seeing lots and lots of children come into the emergency department with childhood illnesses, but we're seeing that on the general practice side as well. An avalanche of childhood illness, I call it. Why is that? Is it something to do with the fact that people have been away in their homes, isolating for long periods of time because of lockdown? And then suddenly they're out and they're exposed to all these diseases? Is that one of the reasons as to why we're seeing all these sort of illnesses come up in one go? Seasonally, I know we get that every year, but this year we're seeing a lot more, aren't we?
Yeah. So I think there's not one cause for this, and I think it's a couple of distinct things which are merging together. So you're right, almost certainly, because lots of children weren't exposed to typical viruses last year. As those viruses have come back, there's been a melee of different bugs coming at the same time, which has meant a higher proportion of children are getting these minor infections at the same time. So it feels worse, but it's just we're kind of making up for a year of no infection in the space of 6 months. But if you also add to that, and I'll talk about this process of anxiety, the general mental health of the nation is not good at the moment, if I'm honest. We have lived through the most serious event that will affect people in their entire lifetime, likely. And I think, given the concern with jobs and the way kind of the economy is going, that anxiety weighs down. And I think if your child is unwell and you've got lots of other stuff going in your life, it becomes a lot more difficult to tolerate some of the things that we used to easily tolerate. And I think we don't talk about this enough, in my opinion. And I think that these two things are colliding, that an increased incidence of potential minor infection, and at the same time, a slight reduction in the tolerance of minor illness, if that makes sense.
That's a really interesting observation, actually, Dr. Rowland, and absolutely in primary care we can second that. And I think, mental health and increasing anxiety about low-grade illness because of what we've lived through this pandemic is resulting in more people pitching up at our doors. Now, one of the most important things that you've said is that fever is not a disease. Fever is very normal. we do not need to treat the fever itself. And you said that at the point by which the child looks unwell and behaves differently may be the point that we choose to give them something in terms of medicines. What type of medicines should we be choosing in circumstances like this?
Yeah, so there's two medications. There's paracetamol and there's ibuprofen. Paracetamol has been around for centuries. It's an extremely safe drug, and it's available everywhere. And just to be really clear, there is nothing that you can do to paracetamol, the basic formulation, to make it any better. Okay, so home brand, cheap versions of paracetamol are no different than more expensive brands. So please buy the cheaper brand. Because you are throwing money away. There is nothing special about these formulations. You should ideally buy sugar-free. I feel sorry for the generation of kids now, because when we were younger, we got full fat, sugar-coated paracetamol. No wonder we enjoyed it so much. But I mean, it's kind of a parental choice. And the first line agent I think should be paracetamol, because it has virtually no side effects, basically. The other agent is ibuprofen. Ibuprofen, again, there's not much you can do to it to make it better, so it's better to buy a own brand, or kind of home brand ibuprofen. Ibuprofen has advantages and disadvantages. It is stronger at treating pain. And so one of the advice I give to parents is, especially for children with earache, and if the earache is really driving the child to distraction, my personal preference is for ibuprofen rather than paracetamol in that particular setting. And I will also sometimes, if you've tried paracetamol a couple of times and you're really not winning, it is worth moving over to ibuprofen. But I just to be really clear, you never need to give both together. In fact, it causes you so much more problems by giving them together. The evidence is clear. It doesn't reduce the temperature any further. And if you give both together, you can then give nothing for the next 4 to 6 hours. Whereas if you give one, please wait a good hour. If after that hour your child is still really distressed, then give the other agent. And you should find that things will improve from then. Some people, because that advice has been given, some people think you then need to alternate between the two, and you shouldn't really do that either. It is much better to start with paracetamol. If it doesn't work, give ibuprofen, and then go back to using paracetamol. And the reason we just give that advice is that ibuprofen, if you use it consistently, can give you a bit of an upset tummy. And it's just nice to avoid having to do that with the child.
Thanks, Dr. Rowland. Really, really useful. Clearly, we only give medication if it's needed for the child and if the child is irritable. One of the challenges that we have, I think in all doctors have this challenge, this expectation that there's going to be a magic treatment that's going to get rid of this child's illness. And often that expectation presents with using antibiotics. So we will see parents commonly request antibiotics for symptoms which are going to be distressing for the child, and the parent feels as if actually antibiotics are the way forward. Tell us why in most circumstances antibiotics are not useful and not needed.
So I think there's two big reasons. So the first is that a lot of infections that appear like they might need antibiotics, and antibiotics treat bacteria, they don't treat viruses, are caused by viruses. So simple ear infections, sore throats, tonsillitis, these are all just as likely, or if not more likely, to be caused by a virus. Even if your throat is completely full of pus, or what we term white exudate, it's still just as likely to be a virus. And these antibiotics will not help that at all. But more importantly, and we've got really good evidence to back this up, is even if your child has a bacteria that is causing an ear infection or a throat infection, your body will clear that. And we've not emphasized how good children's immune system is. And in fact, you don't need antibiotics to help the infection. The antibiotics might reduce your infectivity to other children sometimes, but there's only very rare situations in which that's needed. And then finally, the more we use antibiotics, when we do need to use antibiotics, they become less effective because we have so many bugs now that are resistant. And so the reason why I've given these key things about the less than 3 months in a fever and 5 days in a fever is because they're signs of infections that might need antibiotics to treat. And that if you've just had a fever for 24, 48 hours, there is no situation in which antibiotics are going to be beneficial for that particular child.
Thank you, Dr. Rowland. That's a really, really useful point. So we've established that most children, the overwhelming majority, up to 90%, fever is going to be a normal part of their childhood development. There will be some occasions where parents do need to seek medical advice. Can you tell us or signpost us what symptoms parents should be looking out for that should prompt them to seek medical advice? You've already said under the age of 3 months, a fever more than 5 days. Anything else?
Okay, so there are some things which I think are quite self-evident for parents. So if your child, you can't wake them up. They're drowsy to the point of that you lift them up and they collapse again. Actually, that needs an urgent review. If your child is having a seizure, you should call an ambulance if they're having a fit in front of you. The things that might be happening with a fever which require medical review that isn't so urgent are, I suppose, the things which are quite difficult to explain verbally. So a breathing difficulty. So if your child is really struggling to breathe and that they're sucking in kind of the skin into their rib cage, we call that recession. And the other big thing is if your child has a rash, and when you push on that rash, it doesn't go away. So that it's what it's called blanching, basically. But if it doesn't blanch, so it's called the tumbler test, was a national campaign from about a decade ago. That rash doesn't go away when you push on it. And that does need medical review. But as I say, actually, most children who do have a fever don't have those symptoms, and often the concern is with, well, my child's got a fever and I just want it to go away. The paracetamol and ibuprofen's working, but I just don't want the fever. Well, that's difficult, and we're not going to be able to get rid of the fever.
Thank you very much. So just a reminder to anybody who's joining, please do put your questions on the chat. And on that, we've got one question for you, Dr. Rowland, and we've already sort of established that children's immune system is very strong. Is there any evidence, though, to boost children's immune systems with vitamin supplements such as vitamin C, zinc, or Sambucol?
No. So I can be quite blunt about that. The two exceptions are if your child has been born a little early, it is important. They may not have the vitamin reservoirs that they should have, and you will at discharge from hospital being told to give your child a course of vitamins. But that's something that doesn't get missed. You will have been told that because your child was a certain preterm when they were born. And then the only other thing that I think is worth thinking about is levels of vitamin D deficiency are relatively higher due to the population that we have in Leicester. And I think if a mother is vitamin D deficient, there is a chance that their child may be. And I think if you do have concerns about that as a possibility, that is worth speaking to your GP about. But actually, I would probably defer to yourself and Farhad about that.
Thanks, Dr. Rowland. So no, absolutely, I think that's a reasonable suggestion, actually, because vitamin D deficiency can cause lots of symptoms which need treatment with prescribed medication. What I would suggest is just looking at the NHS Choices website to do with vitamin D deficiency. And if your child does have symptoms of that, then absolutely do speak to your GP. So we've established what parents need to do should they need to seek medical advice. Thanks, Dr. Rowland, for your really valuable input. And I suspect there may be questions on the chat before we come back to you. So thank you, Dr. Rowland. I'm going to bring on Professor Rizvi. So Professor Rizvi, I know you're working very hard to try and manage services in Leicester City so that people can get the appropriate help in the right place at the right time, by the right service, actually. How should parents go to seek medical advice? Where do they go?
Yeah, thank you, Dr. Kapasi. I think it's a very valid question. And before I do that, I think I need to thank Dr. Rowland for giving so much insight on fever. And I feel reassured that my children will be safe if they have a fever. I don't need to rush to A&E for that reason. So what we do is that we have lots of options to seek help, and we are actively working behind the scenes to try and make the system run so that there are options available for all clinicians, patients, children to seek help. So obviously we have a GP practice where you can contact your GP practice, where it will be a GP or a clinician who can see or talk to you over the phone. I'm aware you will be all like saying, oh, there's no appointments available. And that's true, because the system is so much overwhelmed with appointments. And we in fact have delivered 1 million more appointments in the same week as we did last year. So we are running over capacity at the moment. Therefore, we have lots of other options where we can seek help. So we have 111 online service, which is a very, very rarely used service. And this is something which you can use whenever, 24 hours a day. So from the comfort of your home, of your mobile phone, smartphone, you can go on 111 online and type in questions. And it goes through an algorithm whereby it will tell you at the end what should be done with that condition. Other thing is to call 111, which handles around 16,000 phone calls every day, locally, only in Leicester and Leicestershire. And they have clinicians who are well versed with the conditions and can signpost you, advise you over the phone, or signpost you where you should go. Then we have multiple scattered places around the city and county. So the chart here on your screen, which also will be shared on the chat box, contains these sites which have clinicians on board, and they have the set timings, and you can go there. In fact, they are much quicker and responsive than you have to go to A&E and wait there for 4 hours, 6 hours. At times you might find that these places may see you quicker. So please do make use of them. Even if you have to travel a little bit out of the city, I think it's still reasonable. Because if I had my child, I would maybe, if it's not very unwell, I would take them to one of those centers where I could be seen quicker and get the same advice as I would get from A&E or somewhere else. So please make note of these centers and these timings, share it with your friends and families. And I think that's a very, very useful guide which you can take home today from here.
That's great, Professor Rizvi. So really, really important. If your child is unwell and you think they need medical attention, then do not go to ED as the first place. There are all these other places that you can take your child to, and completely reasonable for us to travel a little bit more perhaps. And I think actually it's going to make the parental journey and the child's journey a little bit easier, because often you'll be waiting a very long time to be seen in ED just because they will be looking after very sick children. So often when you call the general practice, and if there are no appointments, the receptionists may direct you to the Leicester City hubs or the urgent care centres. So Professor Rizvi, that sort of graphic that you've just shown us, does that include all the details of where the urgent care centres and the Leicester City hubs exist?
And that's right. So that chart displays all the centres on the map of Leicestershire, the timings on when they are open, and what mode of transport or what mode of method they receive patients from, whether they are walk-ins or they have to be referred by their practice. So those are the two options which you can have a look at and see what things are available. So most things are open from 8 AM till 8 PM. So we have appointments which are required at like Saffron Health, West Coast and Belgrave, which can be made via your general practice. And then there are other walk-in centers and urgent treatment centers where you can just walk in and be seen while you wait. It all depends on the capacity at those places as well. They may not have access to blood tests and x-rays, but often as Dr. Rowland said, we may not need all those investigations, and it might just be a quick chat to reassure and check over the child and make sure there's nothing serious there at the moment.
That's great, Professor Rizvi. So really important to be going to the right place, right time, right service. And you know, it's really important for me to emphasize this, that most children do not need to seek any medical advice at all, or rather parents or guardians do not need to seek medical advice. In the circumstance by which you do feel you need your child to be seen, then you've got your general practice, you've got local NHS urgent care services, and you've got the 111 website, which Professor Rizvi has said is underutilized at the moment. And these resources, such as 111 online, they really are formed through lots of high-level processes. You've got lots of doctors coming together to make sure that the advice that you are given on the website is accurate. Professor Rizvi, we're seeing, I don't know, around 200 children to the emergency department every day. You've already said that we're sort of, you know, seeing 1 million more patients per week as compared to this time last year. Clearly, the health services are working. What would you say to the patients of Leicester City, Professor Rizvi, in terms of what responsibility they have to seek services in the right way?
So no, thank you. I think what you rightly said is that we have a system which is working to capacity, and we have lots of clinicians whom we employ. So if we don't have enough GPs around, for example, or consultants around, we have trained clinicians like advanced nurse practitioners, physicians associate, who all form part of the team, and they all go through a rigorous process of training and education where they can safely see your child in practices, in walk-in centers. So they are equally good as any other clinician you would find out there. So there are different ways we are trying to address the situation here by sending out communications to practices, to patients, doing these webinars here, like this one here, to imbibe the information into patients of what shall be what's the right way ahead for those people. Also on the chat, I saw a comment here about the pharmacies. So we do have the community pharmacy scheme as well. So the pharmacists are also trained clinicians, and they can see a number of conditions, for example, conjunctivitis, constipation, ear pain, for example, and even mild fever. So if a child is unwell, you can take them to a pharmacy which is around you, and they will have a consulting room in the pharmacy, and they might as well check over your child. If they can't, they can advise you where to go from there.
Thanks, Professor Rizvi. So, you know, clearly there are lots of services parents can take their children to away from the emergency department. Of course, the ED is there in circumstances where parents feel their kids are very unwell. And we can also ask clinicians to make that decision in urgent care centres, in general practices, at the Leicester City hubs, and on 111 online. We've had lots of information from Dr. Rowland and Professor Rizvi. I think one of the main sort of points to take away from today is that a fever is not an illness, and it's a normal part of child development. And it's very important that we all take the responsibility of empowering ourselves with this knowledge so that we are able to make better decisions for ourselves and for our children. There are some resources that we've posted on the chat. There's a website, Health for Under 5s, there's What 0 to 18, there's the 111 website. We will also send across resources to do with the Bernardos initiative, where there is a helpline run through for patients and parents who do not speak English as their first language for childhood illnesses. So we'll actually send across those resources to you via email for those of you who've registered to this webinar. Also, I would like to touch base on the next webinar. The plan is to have a series of these type of webinars, and the next one we're hoping to tee up in January. Your feedback is tremendously important because it tells us whether we are delivering the right information to you. We want to know what you want to learn about next. So we've got a few ideas up our sleeve, but we really need your feedback, and you'll see a feedback form posted on the chat. It will really give us insight as to whether this is a useful resource for you, and what you want, what topics you would like to see presented in the future. On a final note, just to say that we are not giving individual medical advice in this webinar. I'm hoping the information that we've used will allow you to make decisions for your child in a positive way through the Christmas season. Very much hoping that you all stay really well over the Christmas season. Everybody across the CCGs at Willows Health, and on behalf of the panelists, would like to thank you for your participation today. Merry Christmas to you, Happy New Year. Thank you to Professor Rizvi and Dr. Rowland for attending today. Thank you for attending. We'll have this webinar posted on our YouTube channel, and really please share this video to empower all parents across LNR to be able to have the information that allows them to make the best decisions for their children. So thank you very much. Enjoy the rest of this windy, dark and wet evening, and all the best to you. Merry Christmas and Happy New Year.